Hello and welcome to the Racial Equity Webinar Series. I'm Kinkini Banerjee, the Coalition's Relations Director at USBC, and I'm so glad to have you join us for this session. The USBC hosts this Racial Equity bi-monthly webinar series with funding from the W.K. Kellogg Foundation. The purpose of this series is to improve our collective learning about the principles of equity and inclusion so we are able to elevate our actions around access, equity, and justice. The ability to acknowledge and work with issues of race and power are a core competency of leadership today, and this is where we engage with the most complexity and ambiguity. These webinars are designed for participants at various levels of knowledge, awareness, and readiness to apply equity mirror and lens to our work in breastfeeding. The equity mirror helps us view ourselves and our organizations or coalitions, examining our own internal structures, culture, and policies. And the equity lens allows us to look outwards so that we can name and understand systemic oppressions and their impact, and we can design more impact strategies, programs, and policies. If you're not already on our on our mailing list, you can join our racial equity learning community, and I hope if you're not already on it, you will join today. Our online learning community provides a host of different learning opportunities and sharing opportunities on the virtual network. We have a webinar on every odd-numbered month. We have a moderated discussion forum, so you can post things, share resources, ask questions, share things that you've been doing, and also learn from your peers. We also have a file sharing library where we go through USBC staff, curates a lot of good materials that come through our own curation and through our partners, and we share them on our learning forum on our file library as well. So here's how you go to a file library. We go to our USBC website, and if you go to the second tab, which is the news and info, click on it and it opens all of the different learning communities. We have more than 20 learning communities on breastfeeding related topics from the Surgeon General's call to action. And you'll find the racial equity learning community among those. For today's session, we know that it's not possible for everybody to attend the session live during the middle of the workday. So we record every session, and you can find the recording as well as today's slides in the racial equity learning community and on the public web page linked below. And you should also see the link in the chat box. So if you click on it, it'll take you to a copy of today's slides that will be used for today's session. Because we have a large number of attendees, during the webinar session, attendees are in listen-only mode, but we want to make it as interactive as possible given the virtual format that we have. So please submit your comments and questions throughout the presentation, and you can type them into the questions box on your webinar control panel. And I'll show you how you can do that. So on the right side of your screen, you should see a control panel. If you don't see it, it might be minimized. So just click on that orange tab with the arrow and it'll pop back out. Scroll down below the audio section and you'll see a tab for questions. When you click on it, it'll open up a box for you to type in. And please, as you we'll be posting any relevant links and things during the chat box during the session as they come up if they're relevant. So please keep a look on your chat box and your question box during the session as well. And if you have any audio or other technical problems during this session, either you can chat them to us or email office@usbreastfeeding.org, and one of our staff members should be able to help you. And that brings me to today's topic, coalition and community building through breastfeeding equity, education, and support. Today we'll learn about BSTARS, breastfeeding sisters that are receiving support. BSTARS is a cultural coalition based in Memphis, Tennessee, and built upon and sustained by community partners, healthcare professionals, and parents. BSTARS is dedicated to engaging the entire community in its journey towards breastfeeding awareness, equity, and sustainability. We will hear how BSTARS utilizes unique ways of creating traditional as well as out-of-the-box relationships with entities in their area so that everyone is motivated to increase breastfeeding rates for the sake of public health, economics, and education. I'm so honored to introduce our presenter for this session, Jada Wright Nichols. Ms. Wright Nichols is a maternal wellness consultant with nearly 20 years of experience in the healthcare industry. She's an occupational therapist and an international board-certified lactation consultant. Jada is the owner of Blossom Health and Maternal Wellness, a private practice which is based in Memphis, Tennessee, and has recently expanded to Atlanta, Georgia. She's a professor of maternal child health and human lactation, a board member of Breastfeeding USA, and she is the co-founder of BSTARS. To so many in the first food field, Jada is a friend, a mentor, a coach, and always, always generous in sharing her time and insights about building community connections and networks for and by communities. And so it's my great pleasure to have Jada, and I'm going to turn it over to Jada now.
Thank you, my friend. I'm so happy to be here. Here we go. Okay. So thank you everyone for taking time out of your busy day, busy week. This is such a busy time of year. So definitely appreciate your taking the time out to join in and listen, and really just, reflect on an experience that I am personally grateful to be a part of, and that is helping to build the Cultural Coalition of BSTARS, breastfeeding sisters that are receiving support. So as Kenny mentioned, BSTARS is based in Memphis, Tennessee. As you can see here, Memphis has issues. We are in the Mid-South, and some of our healthcare rates, our maternal wellness, our infant mortality, obesity, diabetes, cancer, everything that you would want to be ranked highest as, we are on the low end. Everything that you want to be ranked low as, we are on the high end. So when identifying disparities from a public health perspective in Memphis, Tennessee, Shelby County, you'll hear me use those two locales interchangeably. Memphis sits in Shelby County, which is the far west, southwest corner of the long state of Tennessee. There's so much from a public health perspective for officials to identify and to call upon and to prioritize, which, as we know, if we can get breastfeeding rates at in an equitable space, if we can increase the rates, if we can increase the duration, we believe and we know that everything else will be impacted across the lifespan of the infant, across the lifespan of the mother, and through education, through just almost every aspect of public health, these increased breastfeeding rates are able to permeate. So we definitely quite easily identified breastfeeding as a disparity within the city, and we're just very committed to seeing what we can do to get to the very bottom of what's happening. So here's more about what's happening and what's not happening in Memphis. So BSTARS was founded in 2015. So this takes you back to where we were at the time of its creation. 2014, we had just made America's fattest city. I think that was the second or third time that we had received that honor. And oh, so sorry. So for diabetes, for just everything that we don't want, heart disease, Memphis is has a lot of room for improvement. So during the year that we were creating BSTARS, World Breastfeeding Week, this looks familiar to many of you, had this great program about sustainability. It really did help to identify all of the different areas where breastfeeding could make an impact. And so for us, it helped to sell the need for breastfeeding within the community. We could go to almost any entity, and based on this model, based on this toolkit, we could say, look, this is how you're helping to increase breastfeeding rates, breastfeeding awareness, breastfeeding accessibility, breastfeeding education can benefit your area of intended productivity. So we were very grateful for this tool and used it quite a bit. These are statistics from maternal and infant health in Memphis, and as mentioned earlier, just everything that you don't want to be a part of, we are very much a part of. So higher than national average in all of the bad stuff, and of course lower than the national average in breastfeeding. So pretty much setting the tone for this high need of increased breastfeeding support. Here is a graph. The United States averages are in blue, Tennessee averages are in tan, and this is breastfeeding initiation on the left all the way over to breastfeeding, and this is just through 3 months that this is recorded. So we can imagine how 6 months and 12 months will hash out across the state and throughout that first year. So, very, very dismal duration rates. And this graph features WIC participants in the tan and non-WIC participants in the light blue. So still this disparity exists. Here are some breastfeeding initiation. So of course we know that those numbers are always relatively high. I personally don't get turned on by initiation numbers because we know that that's ever breastfed. So that could be one time in the hospital and never again. I like to look further on down the line before I start to pull out my pom-poms. But still, even with this, these discrepancies exist right in the middle that is African-American moms and their initiation rates. So increasing, but the disparities remain. Okay, so these headlines from the state, the even on a national level, point to the need for very focused breastfeeding support or health care for African Americans. We know that, it's been confirmed that physicians and nurses and various healthcare professionals treat African American patients differently. They give them a different level of attention. They talk to them in a different manner. They may offer less pain medications. And it's for a variety of reasons. And then we see down in the right corner where we're seeing more and more evidence of this, where peer counselor programs increase. This is in Utah Native American population. So, and we have more trials, more evidence where really the peer-to-peer support is where moms benefit. So again, just setting the tone, setting the stage for our moms to be really laser focused upon. So this was the breastfeeding support landscape in Memphis, in Shelby County, just before BSTARS came on the scene. So we had about 30 IBCLCs who worked in hospitals or doctors' offices or academic settings. At the time, we had no IBCLCs in private practice. We had about 5 CLCs in private practice, a few Rose Community Transformers, Latch League leaders, Breastfeeding USA, peer counselors. We had 5 WIC peer counselors who worked 10 WIC clinics at the time. Tennessee is privileged to have a breastfeeding hotline, 24-hour, fully accessible breastfeeding hotline, accepts calls from anywhere, but is funded by and focused on parents in Tennessee. So at the time, there were 15 CLCs or IBCLCs who worked on the hotline, various breastfeeding education classes. The Shelby County Breastfeeding Coalition was quite active in helping to advocate for breastfeeding within the community. And then there were various hospital-based support groups and new mom groups. So this is about where I came in. At this time, I was just a mom, just a breastfeeding mom who had breastfed my child successfully and wanted to help other moms to breastfeed their children. So I did transition from from attending Latch League meetings, which were very helpful, getting me over some serious humps, to going out into the community more. So I transitioned from Latch League to more involvement with the Shelby County Breastfeeding Coalition. So during that time, I will just say that in Latch, I was one of brown mothers who attended the meetings regularly. And in the Shelby County Breastfeeding Coalition, I was one of about 2 moms, activists, county employees who attended those meetings regularly. So you see here this highlighted area in the table. Memphis is about 64% African American. So to be anywhere in the city and be the only African American person doing anything, it can be alarming, especially like breastfeeding. We've got to figure out what's happening. What's not on this included in this list is a very robust Facebook group that the Memphis area breastfeeding moms are a part of. And I mean, thousands of mothers who are completely interacting with each other, helping each other out. It is really offering that peer-to-peer support. Moms go on to become real live friends. They set up play dates. They, have, mom's day and mom's night out. And it's a phenomenal layer of support within the community. It is not, however, inclusive. So you have to, at one time, I think this has just changed, but you have to know about the group, and then know someone who's already in the group in order to be added to a list in the group. And then the administrators will add you to the group. So you've got to know who to know in order to be a part of this fun group. So if you're not one of the people who knows that the group exists, like I did not for 9 months, you don't know that the group exists. And for many moms, that's much too late. So again, just layering this need for support in the area. So this is when everything starts to come together. I, again, as an individual mom, and straddling between Memphis and Atlanta, I kind of stalked Kimmery Bug and asked if I could come down one weekend and become a Rose Community Transformer. And she and her team graciously said yes. Rose did not exist in Memphis at the time. And I was, again, just in this mode of needing to help other moms. So this is happening. We are receiving benefit from a CHAMPS grant to help increase breastfeeding support, and still we wanted to do more. Breastfeeding was becoming noticed in the city and in the state. And so this happened just ironically. This is me, but it is a photo that I had taken when my daughter was about 18 months old, and I thought that our breastfeeding journey was just about over. And so I wanted to take some pictures. She went on to nurse another 18 months. So that picture is, where it is. But the photographer ended up sharing these pictures with the state, and as the state's way of increasing breastfeeding awareness. So again, there's this billboard. Now there are buses and bus posters, so just again, another layer from the state, the county, the state hotline. So at a meeting of the Shelby County Breastfeeding Coalition and a yet to be determined group of African American moms, we decided that something official needed to happen. So this is where we first just kind of started meeting each other and talking about, hey, what if we had a group that where we felt more included? And so this is it. This is more about that meeting that weekend. And this is, again, kind of where it started. So we're building these relationships. We have full support from the Shelby County Breastfeeding Coalition. We have great support and cheering on from Reaching Our Sisters everywhere. We've partnered with the Memphis Collective, which is a group of doulas and other birth workers, birth keepers in the area, to really just help identify, solidify, speak out about the need for continued support for moms. So we started just on our own, going to health fairs and just kind of putting a name out there. We had these beautiful images funded again, by rows. And this is really, again, in this place where 64% of residents are African American, we don't see these kinds of images. We don't see them. So Shelby County Breastfeeding Coalition, reaching our sisters everywhere, and the Shelby County Health Department came together and talked about, walked through, thought about what it would look like to create a standalone organization that was really targeted for African American moms or moms of color. And that's when BSTARS was born. BSTARS, Breastfeeding Sisters that are receiving support. It is not exclusive. Anybody can come to the meeting. Anybody is welcome to the meeting. We have had a variety of attendees. The information is geared for anybody, would be relevant for any breastfeeding mom, any breastfeeding family. But the majority of our attendees are African American. But even that is across sociodynamics, socioeconomics, which we're finding is more unique than we thought. So we have in our group, this is from our very first meeting, we have as a part of our group a physician. We have peer counselors, CLCs. At this time, we had access to one IBCLC of color. Now there are a few more, but at the time there was just one. We have in-home moms, we have moms with PhDs, we have moms, who work third shift, jobs. So the group is quite dynamic, quite eclectic, and we just really all love on each other, love on and support each other. Our little babies are welcome. Our big babies sit in the back of the room and do their homework. It is really expected, an expected part of the month. These kids are growing up knowing each other. We had a mom at this meeting ask, she was breastfeeding her first child, and she said, "Do you think that it's possible to get pregnant while breastfeeding, or do I need to stop?" And by the next meeting, she was pregnant. She was actually already pregnant, but did not know it. So she got the answer to her question. But it's a really amazing group. It's attractive to all their moms who receive assistance from WIC. There are moms who do not qualify for that assistance, and it's all good. It is not this or that, these women or those women. It's not women from a specific hospital. It's not women who delivered in a certain way, birthed their babies in a certain way. It is just an amazing spectrum of mothers and supporters. So here we have Latch on Memphis, which, like the rest of Latch group, Latch events takes place the first Saturday of World Breastfeeding Week. And this picture on the top left is what it typically looks like. So again, Memphis, 64% African American, and this picture is who's represented as breastfeeding moms of Memphis. And we just knew that it looked different, right? We knew that it looked different. And so again, the pull was there to get more and more African American moms out breastfeeding publicly, talking about breastfeeding, not feeling ashamed of breastfeeding. Of course, we know that we have these some of these generational barriers to monitor, to fight through. We have, and then we just have the need to really from every direction just break them all down. So this was our inaugural 3K walk, and this is where we just threw all caution to the wind and started asking everybody for assistance. So we had yeah, okay, this is just more about the walk, but I want to get to the pictures, more of our moms. Yeah, so here we are. We asked Hooters for some help. We asked Wet Willies for some help. And we talked to all of these people about breastfeeding. We gathered together, we got t-shirts, we walked with our babies about 3 kilometers out and back, and just patrolling up and down the street, people stopped and asked, and we told them. So we received sponsorship. We received help from Memphis Light Gas and Water, from various restaurants, from the fire department. I mean, every level of sponsorship, every time we received sponsorship, we spoke with somebody who was in a decision-making capacity about the benefits of breastfeeding. So we talked about breastfeeding and disaster preparedness. We talked about breastfeeding and nutrition. We talked about breastfeeding and alcohol consumption. So we really made it relevant to whatever industry our potential sponsor had. We are on one end of the breastfeeding, and then we know that breastfeeding has a positive effect on helping to reduce the rates of breast cancer. So it was only natural that we teamed up with Sister Pact, which is an organization that helps women who are surviving breast cancer. So we went there and spoke about those benefits, the scientific information related to breastfeeding, breastfeeding duration especially, and breast cancer in terms of decreasing the risk. So again, just making these kinds of connections. Of course, we think about connecting with hospitals and connecting with physicians' offices and connecting with, but we were really trying to figure out how to go about reaching into every space of the community. This is another one of our early meetings, and moms just nursing, listening, guest speakers. Our meetings, of course, talk about breastfeeding, but also various other aspects of motherhood. So this is when Rose came back and graced us with another training. So I think about 3 or 4 moms came to this training and became Rose community transformers. And several of those now are certified lactation counselors and on their way to becoming IBCLCs, getting the necessary hours. And that's not even the goal per se, but just to know that there is this space, this avenue where this can happen. We know that it needs to happen, but again, that wasn't the goal of our organization, but it is just happening naturally. naturally. Here at Sister Reach, 3 of our board members were talking about breastfeeding and infant mortality rates and maternal and child health. We had a representative from the health department come and talk about smoking and breastfeeding, smoking cessation, and the impact of firsthand, secondhand, and even thirdhand smoke on the baby, and giving moms, because we have moms smoking not smoking in our meetings, but we have moms who smoke, who attend our meetings, or who live with people who smoke, and so they really wanted to know what needs to happen with smoking, because as we know, too many moms end up saying, you know, we can't, I shouldn't breastfeed because I smoke, or I shouldn't it doesn't make any sense to breastfeed because you know, my husband or my mom smoke, and so it's not going to do any good. So she was giving out great information. Here's a speaker who is a postpartum doula, but she's also a mental health counselor. So she came and talked about postpartum depression. In this particular at this particular meeting, we had a mom who, a grandmother, I should say, who was asking a lot of questions about her daughter who had just given birth, and she's, you know, listening to the speaker and is seeing the signs, symptoms of postpartum depression in her own daughter, and you know, was able to pull aside the mental health counselor. This is our baby shower, our annual baby shower. So again, we're sponsored by the public health, Department of Public Health. Babies R Us chips in, private doctor's offices provide gifts for moms. It's completely free, no strings attached. Come, sign up, get some breastfeeding information. We do make them sit through that, but we give them the breastfeeding information, and also pack and plays and boppy pillows and a lot of great stuff. So more about breast cancer. A Step Ahead is an organization that gives free birth control to moms. It's privately and secretly funded in the city, and they will provide transportation and help with the funding of whatever birth control you know, you and your physician decide upon. So there we talked about the impact of various types of birth control on breast milk supply. We talked about National Nutrition Month, partnered with the March of Dimes. And then here we have just group members figuring out what are we going to do next month or next year, over the next year. So you see that we still have, it's a different group of moms, different moms, but still very full, very active meetings. We have a lot of moms who come, who breastfeed their children, who wean, and they still come because they enjoy being able to offer additional support to you know, the next batch of moms. Here's a meeting where we honored mothers for Mother's Day. So this is the Memphis Area Breastfeeding Symposium 2016 was our first, and the goal was to, again, partner with the health department and the coalition to get health providers educated, and not the lactation consultants or the lactation nurses, not to get them educated, but we were hearing from so many moms that my doctor doesn't understand, or my doctor, you know, told me one thing, but you're telling me something else. So we wanted to give everyone an opportunity to hear best practices, hear the latest evidence, hear the latest interventions about breastfeeding from a health provider's perspective. So we created this Memphis Area Breastfeeding Symposium. We've now had a second one. The third one is now going to be the Tennessee Breastfeeding Symposium, as we take it to a different part of the state. So it is expanding, but it is, again, a partnership among BSTARS, the health department, and the Shelby County Breastfeeding Coalition, and in the future, the Tennessee Breastfeeding Coalition, and there'll be more of that in a moment. So we have at this event, we have city officials, which is really nice because, you know, they get to hear how policy or accessibility affect breastfeeding and breastfeeding rates. Some of it they know, some of it they have no idea. So that's our 1-year anniversary. This is when we first got the notion that cultural coalitions were a thing. Tiana Piles, another co-founder, was asked to speak at Rose about the work that we were doing in Memphis, and we were like, oh, cultural coalitions, that's kind of cool. And then, of course, got to USBC and realized, oh, we kind of are a cultural coalition. So now we are officially a cultural coalition another year later. But yeah, this was it. And that's Tiana and her breastfed babies. So these are all of the organizations that worked with us, contributed time, energy, money, food. For each one of our meetings, we ask the speaker if they are able to sponsor the meal that we have at every meeting. And most are definitely have the budget somewhere to make that happen. So it makes it really nice and really easy for parents who are bringing their children to the meetings. They do get a pretty hearty meal. And so they don't have to make a decision between going home and cooking or attending this meeting. So we try to take again, remove all of the barriers here, even more, just all throughout the city, everywhere we go, even if we're not doing BSTARS work, we insert breastfeeding into the conversation somehow. And we talk to restaurant owners or restaurant managers, or store owners or doctor's offices or anybody we come across, and talk to them about how, in a really informal way initially, but talk to them about how this space would be more valuable and more valued if they support breastfeeding families in a certain way. And so we get into the long-term effects of long-term benefits of breastfeeding. I mean, just everywhere we go, we leave no stone unturned. So, what is happening with BSTARS? What's next with BSTARS? Really, sky is the limit. We are we're beyond our second year, and we've served hundreds of mothers, families, and we want to continue to be, and the goal has always been to be, a self-sustaining organization. So we are having our training wheels removed, and we are finding new and creative ways to support the organization on its own. And a big part of that, a big part of that is our board of directors. So you're going to have to just look at this picture of Tiana and myself as I talk through about 6 slides that aren't on here, but they're just more beautiful pictures. So the board of directors is comprised of some of the co-founders who, again, are all throughout the community. So this is where, you know, you really want to think about as, you know, you might be creating a cultural coalition. Identify members who are already working or volunteering within the community. So you know who you know the people who work with you, you know the people who are at the health department with you, or who are in the doctor's office with you, or who, wherever you are, you already know those people. Find people who are outside of those entities so that your wingspan can be that much more encompassing. And that's what our group of directors is comprised of. So you definitely want to identify the disparities. We did a good job of that. Memphis makes it easy. Identify the underserved, that is moms of color. Identify the stakeholders. Those are your you know, known breastfeeding advocates and healthcare professionals, those who are already treating families and babies. And then apply a breastfeeding equity lens to everything. Like I said, when we, you know, we'll go to, you know, certain bathrooms in a public space, we look around and see, can breastfeeding happen here? Not in the bathroom, but can breastfeeding happen anywhere in the space? Where would it happen? Where does it happen? And if it happens at the table, that's fine. We give those people a breastfeeding welcome here sticker. But we really look at everything in terms of how can a breastfeeding mom thrive right here where we're standing. Identify sponsors, and that's everybody and anybody. It does not have to be relegated to the safe comforts of the healthcare or public health industry. It's anybody. Remain visible. So we have shown up at music festivals and art festivals and races, and of course health fairs, you know, just everywhere, anywhere a mom may be, you may find BSTARS there. And again, we just spend so much time talking up breastfeeding, art galleries. Tiana has a connection at a local art gallery that's in an older neighborhood that is being revitalized, not regentrified, but revitalized by its own. And so we have partnered with an art gallery there to show pictures of moms breastfeeding throughout the city. One of the things that I think we are most proud of, I don't even know if it's most, I won't prioritize it, but it's relevant here, is that we believe that our work with BSTARS has really helped to revitalize, inspire work of the state. When we started, the Tennessee Breastfeeding Coalition was named something else and was really sleeping. It had not done much in a couple of years. So even when we went to the USBC conference, we were really representing Shelby County Breastfeeding Coalition, which again is in that small corner of the state, because the state coalition had not sent representation. And so our work with BSTARS, the excitement around BSTARS has really helped to inspire the reconnection, the interconnectivity of the Tennessee Breastfeeding Coalition. So we'll be back. We are back. So let's see. There's our art. We've got moms who are just now around town. So you remember the Latch picture, and there are moms who are just around town now. Moms around town sitting and nursing their moms in a public space. So not at a nurse-in, not at a sit-in, but they just gathered from our meeting. They just gathered together and took their babies to a story time and sat and nursed their babies. And 4 years ago, I had a baby at story time. That was not happening. So moms are feeling more empowered, and they are just really feeling like they belong as a breastfeeding mom in the city, throughout the city. I've got to show you this picture of these amazing dads showing giving support at one of the meetings. And then of course all of this is documented with our social media presence, which has grown tremendously thanks to our tuning into one of the USBC webinars surrounding social media. So this is where you can find us, and we are more than happy to talk to any groups, any cities, any coalitions who are wanting to have a coalition similar to this. Thank you. I'm ready for questions.
Wow, thank you, Jada. What a compelling, uplifting presentation. I mean, this really, BSTARS so expertly weaves breastfeeding support with building a thriving, resilient community. Like that is your vision and aspiration and reality. I mean, you are really showing how very, very smart business acumen can be informed by principles of inclusiveness, social and racial justice, health justice, and how to, so that you can overcome a completely inadequate system of lactation support currently. So this is fantastic. And just looking at the pictures and seeing just how rich the conversations are in your in the BSTARS meetings that you have, having intergenerational groups, to have children be part of it, to have moms be part of it, and really demonstrating that to move from incremental improvements to transformative change, we really need to work with the specificity of the context and the richness and strengths that are inherent in our communities. So thank you again, Jada. We do have a lot of questions, so I'm going to.
Okay.
So, one question is, who were some of the, champions that helped you? One of the questioner from another state starts that we are trying to do the same, but the dominant coalitions sometimes is constantly either unsupportive or doesn't recognize works of color very much, so they are having some barriers there. So who were your how did the original group, and you
Right.
mentioned that how important it is to have that a county or some champions,
It,
early champions, but if you can address some of the barriers that folks are facing.
yes, and that we were able to, or we had to work backwards. Honestly, I don't know that this would have worked as well had the uh, state level coalition been up and running. We probably would have felt like we were pulling away from them, but because on the state level at the time, we were really able to forge our own way. So we already had relationships with organizations, and this is, I think this is important. It comes up a lot within within our community, right? Where we struggle with being a part of, or being excluded. My personal feeling is that you have to be at the table in order to be a part of the conversation. And if you're not at the table, you are on the menu. So I am one of the ones who appreciates being everywhere. And if I am ignored, which of course I have been, if I am talked down to, which of course I have been, like, all of those things absolutely happen, but it's going to take some effort. I'm not going to make it easy. So you need those people, and that's not a role for everybody, right? We have people on our board who absolutely will not go to events sponsored by the majority organization, and they've been here, done that. But we have members who don't do it. We have, and I'm one who will, Tiana's one who will. And so, the energy was there, the need was there. We identified that this is happening or not happening, and it needs to. And we spoke with who we knew, and worked around we identified those who were not supportive. They're, not any more supportive today than they were 2 years ago, but we had to press forward.
Thank you, Jada. And for those who, are struggling, the point that you made that was so important is that sometimes if you see yourself as a child of the state coalition or the other, then it seems more like pulling away. But when you've created your own entity, you're an equal partner, and sometimes they get so much leverage from star coalition like yours, and it's so mutual. Then the Shelby County, the local county benefits so much from the work you're doing. You benefit from them, and then also Rose has community transformer training. So for those of you who are wanting to start a local coalition, we have such great examples with Jada and Tiana from BSTARS, Mudiva from DC Coalition, just other coalitions that have done this and have created such rich coalitions there. So use on the Coalition Learning Connection, we can connect you with folks. If folks here we'd be glad to share the participant list with others. One other question here, Jada, is that, lots of comments about how wonderful this session has been. And Liz Brooks says, thank you, Jada and Tiana, for building such a great model in Memphis. I love the idea of having local sponsors and speakers provide meals. And she wanted to know, does BSTARS offer any sort of recognition or award for any of your business partners right now? Is that being done currently or in the offing?
So they have the great honor of being placed on the back of our annual shirt. No, we send them a beautiful written letter, but that is all. So and this that definitely needs to happen in a more official way. And this is where some things can get a little bit hazy. That is a an activity that the local coalition is supposed to be spearheading. We are supposed to be working toward identifying the organizations that support breastfeeding, right? So whether it's, setting up a nice space for a breastfeeding mom or whatever it is, supposed to be identifying them and acknowledging them in a very official way. So I think a part of what happens when you're dipping your toe in all of these places is, I know I personally thought, oh, well, they're going to be acknowledged by the coalition, so we could just get that list or tag on to them. And we definitely need to hold a more formal recognition, because many of the sponsors, in fact, are different. And just let me say, back to sponsors, I think one of the things that has made it a little bit easier is that, really nice three-pronged approach. We were not asking the local coalition to do everything. We were not asking Rose to do everything. We were not asking the health department to do everything. They all chipped in different amounts of support, whether it was financial, whether it was a space or free advertising or making flyers, whatever it was, they chipped in all in different ways. So together, it was really quite collective, and with a lot of grace. But we were not dependent. We have not been dependent upon a single source. So if anyone decided, and that's really what you want. Once you identify your partners, you want to very clearly identify how long this partnership will last, because you want to be self-sustaining. So, as the training wheels come off, when is that going to be? Is it going to be after a year? Is it going to be after you serve 100 families? When is that going to be, and what does that look like? What does that look like? And who proceeds, whose name remains on the back of the shirt at that point. So those are things that you want to start asking up front.
Absolutely. And like you said, equal partnerships. So where, there's just so much bi-directional benefits to this kind of strong partnerships. Just the visual of the kind of partnerships BSTARS has built is fantastic. And Liz follows that up with just perfect. And she says, think of a decal that they can use, put in the window: BSTARS and breastfeeding families welcome here. I think that would be great. We have another question saying,
yes. Love it.
What kind of resistance specific have you faced from dominant culture individuals or organizations regarding creating a space or services by and for families of color? And how have you responded to that resistance to help those with a privilege to understand the importance of your work and more effectively support your leadership?
So we have had intimate conversations. One of the pictures that unfortunately I wasn't able to share on this particular presentation, but Kenny, that's this, and Danae, that I'm going to send you a different presentation more. That's about 6 slides more. But I wanted to, in our second symposium, we had Dr. Kamara Jones, who, of course, came and spoke about equity. And again, this was to a room of healthcare providers, and they were visibly uncomfortable, but they also wrote in their comments, there were some, of course, who loved Dr. Jones, and there were others who resented the fact that we would even talk about equity in healthcare. They have nothing to do with one another. They came to hear about breastfeeding, and here we are talking about race and racism. And so we do have a long way to go. So those conversations in big rooms have been either avoided or very challenging, but in the smaller, more intimate rooms, in spaces where, a small board might get together, or a smaller group of colleagues might get together, we do have the conversations. They do know that the problems exist. They're just not sure, and I don't want to speak for, make excuses for. We're all here. We know what that looks like, but they don't know what to do. They don't know what not to do, or what not to say. Again, I would say that because we pressed ahead despite whatever they were whispering about or thinking, we were able to do more. We did not barge into another support group meeting where we had already individually been rejected or excluded. We didn't really try to take over anything. We didn't say, look at me, look at us, pay attention. We just moved. And then they could not help but to watch what we were doing and what was happening. We do have, I forgot to mention, we do have a joint meeting every year. In fact, it's this month with the Shelby County Coalition. So we have a joint meeting. The Shelby County Coalition has a joint meeting once or twice a year with the USLCA chapter. So we all know, work, live, laugh together. So there is this, we are very much interconnected. And I just think that as much as we want our own, I think that interconnectivity makes the transition, the creation, the sustainability just that much easier.
Thank you, Jada. Yes, and we see, everything you said, we see across, playing out in every single community and in the state, across the other states, coalitions where, cultural groups often face a lot of challenges coexisting or being able to have any agency in the birthing and breastfeeding field. So that you just have to work so much harder to do that. But we, with our network of state coalitions, it's a long journey, and we've just started our process with understanding for state coalitions that equity is not an option. Like, it has to be front and center. And if you're not thinking about race, then you're not really doing the business of a coalition anyways. So moving, another question we have here is, again, with folks who are working on community involvement, engagement, and doing things with and by communities. What specifically do you attribute to your success in reaching and recruiting breastfeeding moms in the community? So you all definitely did have that special sauce that you were able to bring that together.
Yes, so we have on the board, we have a couple of peer counselors who do work for the health department. So they invite the moms who they see. We have I mentioned that very active breastfeeding group on Facebook that is run by the majority. I may or may not have sent moms of color private messages and have said, hey, we have another group and we have another meeting and we would love to meet and see you here. And, by and large, they say, oh, I had no idea. This is great because I've asked this question 3 times and nobody has responded to me. So I have gone to get some of them and say, definitely stay right where you are, but also come meet us in person. And so and once they come, they don't want to stop coming. So it's not, it's not a deal where we have to really struggle to keep them. Once they come, they don't want to stop coming. So yeah, I mean, we love them. We love them. We love each other. We want the best for them. Like, there are 0 ulterior motives, and they know that. They feel that there is an exhalation that happens when they come to a meeting. There are tears shed because women have felt so isolated because they are the only ones in their family in the last 3 generations and cousins on both sides who have decided to breastfeed, and they don't know that support exists. But they read a blog post about how this is what they should be doing for their babies, and we say, come here, come to us, and we can help you, and bring your mother and grandmother and husband, so that we can all talk about it. So it's just genuine. I don't know. It's just us, but it can be anybody.
That's exactly it. Welcoming, inclusive, authentic. Everything. This could be a lesson for other coalitions, because so many other coalitions are public health centric, and that if we involved our moms and the communities more as members and leaders in our coalitions, county, local, state coalitions, what a difference that would make in the scale and scope of our impact. One other question here is 2 questions actually, and you can take them in the order that you want. One is, what is the most unusual community partnership or ally that you formed, and how did you convince them that breastfeeding was important to their organization? And the other one was to show the WIC bar slide graphs again. So if you could show us what the rates in Tennessee and specifically are right now with WIC and non-WIC.
Okay. So I think the most hilarious, is this WIC? This is, let's see. This is WIC and non-WIC. Is this the one that's wanted?
Thank you. Yes.
Okay. And this is through 15. What we have in 16 for 16 is projected, and the rates have not shifted a lot. We're inching up. I didn't bring in any MPink survey results, but what we're finding with MPink is that all of our rates for initiation are continuing to increase. However, Tennessee is not increasing as quickly as some other states are increasing within the same time frame. So there's still something that is missing. I will say that for a while, for about 1.5 years, we only had for whatever reason, BSTARS was the only mother-to-mother support group that was functioning in the city. Latch had taken a break, and some of the other organizations. And so I know that moms during that time, families during that time, were not receiving the support that they had. And I strongly suspect that our numbers for 16 and even the early part of 17 will be reflective of that. I'm just saying that wasn't a question. I'm just saying. But okay, so I think that our Hooters partnership or allyship was just hilarious. The first year they provided us with a rest space during our walk. The second year we actually met a Hooters girl who had just weaned her like 15-month-old, and that was just in her, her breast still looked amazing. Like I think that's hilarious. A partnership that I never in my wildest dreams would have thought of, but that Tiana Piles is so entrenched in everything community, is the community emergency preparedness program that we went through. So some of us went through this 2-day training of how to help our community in natural disasters. So, and this was, a while ago, like pre, crazy hurricane 2017 season. But we would have been the people who had been trained to help our communities, and so we have a T-shirt. It's a coalition T-shirt, but we wear it nonetheless. Top 10 reasons for breastfeeding. Number 1, breastfeeding is disaster preparedness. So, but we were able to go and talk to while we were receiving our training. We were able to go and talk to those firefighters about the importance of breastfeeding and how a breastfeeding mom and baby, in a natural disaster would fare far better than some others. So much so that they began including it in their training for their own employees. So I just thought that was a magical moment, and it really helped to solidify the notion of, honestly, breastfeeding is everywhere.
That's fantastic. And, disaster preparedness, you just brought that up. It's so, so critical. Right now, there's a core group of folks who are doing it in Puerto Rico. And it's so fragmented, and infant and young child feeding in emergencies. Lourdes Santabaya, who is from Puerto Rico, is training folks to go to areas, and we'd love to invite her when she's able to come and share. This is something that has to be a core competency of our that coalitions help with their state health department or local health departments and community partners do that. It just takes one, like you said, one event to create that. So that's such an
great
important
work as usual.
Yeah. So another question here is saying, how can we, I live in a city where with a very small critical mass, very small percentage of Blacks where work by African Americans are quickly erased or claimed by others. Black mother stores are being used but not helped. What suggestions do you have when we have a smaller critical mass to begin with?
I would say just find a way to bring them together. I mean, I did keep emphasizing that Memphis has this large population of African Americans, but our group is still relatively small. So just finding a time, a space, a moment, an opportunity to bring them together, you know, it will just begin to happen. It will just begin to happen if they are all in the same space. I know that. So my daughter is 4 years old. We have, you know, others on the board who, you know, have a 5-year-old or a 6-year-old. So we really just, before BSTARS, we had really just all missed each other. So we were out breastfeeding, but there was no opportunity for us to ever come together and know that the other even existed in the world. So just finding a way to bring them together, you know, authentically and thoughtfully, you know, is the best way to get something started. You don't have to have it figured out day one.
Right.
But yeah, just bringing them together. Look, there is more than just you. There's more than just the two of you. Yeah.
Thank you, Jada. Yeah, starting small, and then thank goodness for social media and other
Right.
groups that one can start and work with as well. There was another question on, well, Tiana is on the line. Are we able to
Hey,
unmute her line, Danae? Danae, are you able to unmute Tiana's line? Well, welcome, Tiana. We are so glad you can make it.
Sure. 1 second. Tiana, you can say hi if you'd like.
Can you all hear me?
Yes, we can. Welcome, Tiana. She's one of the co-founders of BSTARS.
Greetings, everyone. All you sisters.
Thank you so much. This has been, we are flooded with comments about how inspirational this has been and just how many ideas we have. So we want to keep that the conversation going on our learning community. And Tiana and Jada, can we share your emails with others who want to be starting
Yes.
cultural coalitions as well?
Yes,
Sure.
so I'm going to give you a different presentation, as I mentioned, an additional presentation. It will have Tiana's correct email address. The email address that I just posted is not her correct email address. So if you wrote that down, scratch that out. It's tpiles@bstars.org, but we will put it in the forum and then on the presentation slides that will be available after this.
Terrific. And then we have a couple questions about your symposium. So could you tell us how the idea germinated? How did you get started? And now you're actually making it state level by moving it out of Memphis. So what was the progression of that?
Anna, go.
Hey, wait a minute. I was supposed to be just listening.
Yes, I know, you're too late.
Well, it was definitely something that was needed in Memphis. And as Jada wonderfully spoke about, we definitely have a lot more work to go, but it was awesome. Jada, as you were talking about Dr. Jones being our keynote, that was a dream come true as we were sitting there listening to her in Memphis talk about some of these needs. However, there are also needs across the state. So as we've been doing what we have been doing locally, the state was interested in having us use some of that energy and moving that energy across the state. So we have been a part in helping the Tennessee Breastfeeding Coalition have more of a presence. And what a wonderful way to be able to bring that conversation to different areas and coalitions across the state and emerge as the Tennessee Breastfeeding Symposium, putting our state on the map.
It's fabulous. Fabulous. We have time for one, the questions just keep coming. We have one more question about how, do you, and you did mention the promotion and, outreach to moms, but, what was your greatest challenge in maintaining regular attendance? As you said, once people come, they love coming, but how do you get more, newer and newer moms to come? How do you get outreach to mothers other than social media? Do you have other things that you do?
Jada, are you turning this over to me?
No, I'm here. I'm just yeah, it is social media. It is word of mouth.
Yes.
You know, so we'll have one mom who will come, you know, maybe by herself, and then the next month she brings another family who she knows. They don't know anything about BSTARS, but she knows them, and she invites them to come. I know that when I had gone to breastfeeding support groups before, I never felt like doing that. It was, you know, it was just my thing to do, and I did it and met up with the moms who were there, and I never felt compelled to invite other moms. These moms, these parents really do, and I'm going back to parents because we have, you know, fathers who come regularly, and you know, and partners who come regularly. So it really is quite inclusive. You know, you saw, I didn't point it out, but one of these pictures is, I'm gonna get frazzled now, but is a mother, an expectant mother, her mother and her grandmother, and the mother and the grandmother never breastfed or weren't successful beyond, you know, a couple of tries, and here they are. These beautiful ladies in the upper right, that's 3 generations, and you see the mom's little bump. She has twins there. Those twins are toddlers now, but this is a daughter, a mother, a grandmother, and they didn't know anything about breastfeeding and came to our meetings to really get it so that they could support her. And this is truly what it is all about. They did not sit back and say, you won't be able to do that because we didn't do it, or that's now, or any of the things that we hear moms, grandmothers, mothers-in-law say. That they wanted to, 2 generations who did not breastfeed wanted to help this young mother to breastfeed. So it's just like, this is the magic. This is the magic. And we also talk about breastfeeding. We get that in. So, but yeah, but this, I mean, this is it.
That's exactly it. Like you said, Jada, that, you know, the pounding of the pavements that you do, going to, leaving no stone unturned, going to every single community business, other entity that you can think of. That's how word gets around, and that's how folks know that there's a BSTARS, there's a place where families can go, and it's much more than breastfeeding. They can, that's their place to rest, to rejuvenate, to
yeah. I was just going to say, I have seen Tiana getting her tires rotated and bring up breastfeeding to man behind the counter. This is a true story. And so we start to talk about breastfeeding journey. Like, literally, no one is safe from a conversation about breastfeeding if you see us in the community. So that's just how it has to happen.
That's terrific. And one last question, really,
Okay.
this is our last question.
All right.
How do you coordinate your work with the local healthcare providers who care for the moms and babies right now? Are there connections with hospitals and prenatal and, you know, OBGYN, these other clinics as well, community?
So all of the hospitals know that we exist. No, and I'm saying this as a former hospital employee and a person in private practice. So I've seen it from a variety of vantage points. The hospitals are not doing, across the city, are not doing a great job of sending moms to support once they leave. And they know that. The nurses know it. And what they say is, we don't know where to send them, although they see us at the meetings. And this is for moms of color, and this is for all moms, all parents. They are just not doing a great job, which is why we have, you know, we're struggling with baby friendly within the city. It's they know that we're there. We make our presence known. We are accessible. There just has to be a cultural shift. And this is a part of the symposium as well, part of the reason, justification for the symposium, because we really need those providers to understand that there's a place to send their breastfeeding families.
Great, thank you, Jada. And we will continue this on the learning community. So please, if you haven't joined the racial equity community, join, because there are a couple other questions that I hope Tiana and Jada, we can send you over our community and keep the conversation going. But thank you again for a phenomenal session. And thank you to you all, our participants today, who offer all you do to improve the lives of women, children, and families. So you can find the recording of this webinar session. It'll be posted later today. And I hope for all your colleagues and friends who weren't able to attend live, please, please promote this and make sure that everyone gets to hear what an amazing job BSTARS is doing. So thank you again, and I look forward to us being together again for our next session. Goodbye for now.